Welcome to the afternoon constitutional, and I appreciate you sitting there saying, yeah, we know government accountability and oversight, we've got it, but we've got a lot to cover this afternoon, and, we have all the time in the world. It is the internet. I don't have to hit network breaks or anything like that. So we will dive right in with the first question of the day, which is medical care. And I've said this to conservative friends of mine on frequent occasions. I said, if you don't think for a moment that these issues are important, then you're kidding yourself. There was just a Harris poll that came out that listed cost of health care is still one of the top 5 issues amongst Americans. So it is to our own peril to ignore these or whistle past the graveyard. So joining us from the amazing organization Americans for Prosperity, and to take us in to a plan that they've put together to try to rein in the cost a little bit of Medicare, and to come up with ways, because the demagoguery is kind of stunning as you listen to the folks who are name calling just dropping everything here, name calling and threatening all the seniors in our area that if the debt ceiling isn't lifted, catastrophe is going to strike. And of course, part of that catastrophe will be the end of Medicare and Social Security and all that fear mongering. Charlie Katebi, and I hope I'm pronouncing that right, is on with us from Americans for Prosperity. If it's Katebi, I apologize, Charlie. How are you doing today?
I'm doing well. I'm doing well. And it's pronounced Katebi.
Oh, Katibi. Okay. Well, very
Very
good.
close.
Uh,
Very close.
Close only works in government work, and neither of us do that. So, Charlie, I appreciate that. So, talk about, first and foremost, do you run into the same folks that I do that sit there and say, well, it's a leftist agenda item, and we shouldn't even talk about it, and ignore the issue altogether? Or, as conservatives, should we dive in and say, hold it, we have better free market based solutions to these problems, so that when these people throw the rhetoric around, we can actually say, no, we've got marketplace ideas that will work.
hmm So I disagree completely with the idea that healthcare is a leftist issue that conservatives, free market folks should not engage in. Everybody faces a healthcare issue. That's this is just a simple fact. And we have to come and say that we have the solutions to these problems that everyone faces.
Mm-hmm.
Everyone is going to face a healthcare issue at some point in their lives. And we need to let people know that we have solutions to deal with those issues, to make it known that markets, competition, real choice actually delivers quality healthcare, and to let them know that the leftist, the progressive, the Medicare for all solution, that's not the right approach to fixing these problems.
So what have you come up with, and where did you begin in trying to come up with some steps that not only are going to, help ensure Medicare, as I understand the plan that you've put together? Not only will it ensure Medicare right now, but it'll also help in the process of cutting our federal deficit over time, if I'm reading the tea leaves correctly.
Yeah, absolutely. So Americans for Prosperity's solution to our healthcare problems is called the personal option, which gives power back to consumers and patients to make better decisions over their healthcare. And what we've noticed is that in our healthcare system is dominated by monopolies, insurance monopolies, government monopolies, and hospital monopolies. And monopolies wield power, and they wield power at the expense of patients. We want to give power back to patients by empowering them with more choice. Because when you have choices, you can say no to a high cost
Mm-hmm.
hospital. And so one of these solutions is known as site neutral payments.
Okay.
And so right now, currently in our country, if you're a doctor, you will be paid 3 times more by Medicare if you are part of a hospital chain than if you are independent.
Interesting.
Yes, that one policy provides a gigantic incentive for doctors' offices to merge with hospital chains and basically establish these local regional monopolies. that is a huge problem for any patient that cares about the high cost of healthcare.
So, is it an exploit of the regulation? Is it regulation that actually created these resistance to an independent, old country doctor is what they, used to be called? Because I remember in the establishment of Obamacare that a lot of people were pointing to the high cost of the insurance that a medical practitioner is going to have to carry on their office as one of the things that was driving everyone into these regional and then healthcare system managed organizations. Is that part of it? Is this site neutral plan in part eliminating some of the regulations that make it onerous to be an old country doctor?
Yeah, I would say that this is actually an issue that really predated Obamacare. So
Wow.
this is all about how Medicare spends money. So Medicare has a certain rate that they pay doctors for certain services, and this is all outpatient,
Hmm.
chemotherapy, drug infusions, and then they have a separate fee schedule for doctors that are owned by hospitals. And those rates are double, triple, sometimes even four times the rate of an independent doctor. And the reason for this is there's this idea that hospitals have higher overhead costs than doctors' offices. They are dealing with emergency care and acute care, but those economics are not at play for just a doctor's office that just happens to be owned by a hospital. That doctor's office that's owned by a hospital, they aren't delivering emergency room services or acute care. They're just delivering outpatient care.
Hmm.
The only difference is that they are billing as a hospital and billing significantly higher rates. And those rates, those don't just drive up the cost for taxpayers, that drive up the cost for seniors, because seniors are on the hook for 20% of the cost of any outpatient service they receive. So this is a big hit that hits seniors in this country.
So what do we need to do? Is it a state by state fix to create these site neutral billing plans, or is this something that the U.S. House of Representatives and the Senate have to agree on and get Joe Biden on a good day to sign it for us?
It would be very good if we got Joe Biden on a good day on this issue. Unfortunately, this is a federal issue. Medicare is a federal program, and this has to be done through Congress, as slow and frustrating as Congress is. But I will say this, there is a lot of hope that this issue can get done. Americans for Prosperity has partnered with 20 organizations on both the left and on the right to support these reforms. And this is the left and the right disagree on a lot of healthcare issues, but on this one issue, we agree. Monopolies are driving up the cost of healthcare, and the solution is for the government to stop subsidizing those monopolies. And so I feel very fortunate and very hopeful that a lot of very influential lawmakers are interested in this issue. So the Energy and Commerce Committee in the House of Representatives, the Ways and Means Committee is also looking at this issue.
Wow.
The Education and Workforce Committee, they're also looking at this issue. And in the Senate, a lot of great leaders. Senator Braun, for instance, he's very interested in taking on this issue because he's from a state with very high healthcare costs, which is Indiana.
Well, we happen to, we're pretty good friends with the chair of the Health and Education Committee, Congressman Good. So if you need any leaning, we can lean on him for you and try to get this moving forward.
That's fantastic. We would Americans for Prosperity would love any support. I believe Representative Good is a very major supporter of site neutral payments, but I'm sure he would love the support as well from your listeners.
So what does happen then? And I worry because these hospital systems are becoming bigger and more powerful. Use the M word, monopoly, and they become almost like electric utilities, where the government says, "Well, you're the hospital, so we're gonna look the other way when you're the only game in town." Especially in Virginia with the Certificate of Public Need laws and how hospitals can keep out competition even from smaller providers that way. It seems like a collusive situation there. So locally, can we work on things like the cons, the certificate of need legislation, so that when Congress does act on these site-neutral Medicaid plans, Medicare plans, that we will have a robust economy of those providers to help drive down the cost, Charlie?
Absolutely, absolutely. So if God willing, we can get site neutral payments enacted out of the federal government. That is a crucial first step, but it's just the first step. At that point, the federal government will stop subsidizing these monopolies. But then a lot of this is going to fall on state lawmakers, like you said, in Virginia and other states that are in charge of these certificate of need laws. So these are laws that basically act as a barrier, a government imposed barriers on new hospitals, on new surgery centers, on new outpatient facilities. Those laws contribute to these monopolies by keeping out the competition. So if we can get site neutral payments, we should absolutely also aim to remove these really burdensome state level barriers known as certificate of need laws. That would allow a lot more low cost facilities to come in and actually force our healthcare system to compete for patients. And that's what you need in a functioning healthcare system.
I think I'd like to take whatever we're able to do with this and start copying the laws for our retail establishments and for our manufacturing and pretty much every other marketplace out there. We were just talking to some of the folks from Ed Choice yesterday, and they're having so much success with that. Maybe Milton Friedman's other project, which is free market capitalism, may come back at some point too, because what you're talking about is really crippling so much of our American society right now. Charlie Katebi is on with us from Americans for Prosperity, americansforprosperity.org, and their Medicare. Can the viewer and listener go and take a look at this plan back home from your website?
Absolutely, absolutely. If they Google AFP call on Congress to establish site-neutral payments in Medicare, or just Google AFP site-neutral payments, they can read this letter of support we sent to various committees in the House who are looking at this issue, walking through why this reform is needed, what are the giant problems in our healthcare system.
Right.
And if your listeners are understandably really worried about the high cost of healthcare, they're frustrated that they don't have any choices in our healthcare system, I would urge them to reach out to their members and just let them know that there's a solution. And that solution is site-neutral payments.
And so it appears that these things are in committee right now. What is the time schedule, Charlie, that we need to be watching for to get these things, to make sure when hearings are coming up that the letters are filling up these inboxes at the House of Representatives?
Yeah, I would say today, the Energy and Commerce Committee is marking up a slew of healthcare bills that cover a whole number of issues. But one of them would establish site-neutral payments for drug infusions within outpatient facilities. And I know this is a major service that a lot of people rely on. So today there was a markup in Energy and Commerce. I know in Ways and Means, who also has jurisdiction over this issue, they are also going to be looking at marking these up in the next several weeks. I know the Ed and Workforce Committee, they're also going to be thinking about this in June and July. So if your members have, if your listeners have members who are in those committees, I would urge them to reach out, talk to them about this issue, talk to them about the solutions, and let them know that this is something that they want, and this is something that they will hold their members accountable on, because this is a very important issue.
I would actually take the phrase the way you were going to say it, if your members have listeners, because if they are listeners, they should be hearing this. And I think it'll be refreshing for, we're going to visit with Congressman Good at some point this week, because there's this other, there's something going on in Washington with ceiling. They're having the ceiling painted.
Oh, a debt ceiling.
Oh,
You
that's
refer
right.
to a
It was the
debt
debt ceiling.
ceiling.
That's right.
Yeah.
And I segue by using that to bring what I imagine is maybe an intended benefit. I'm not sure, Charlie. That because they've demagogued, oh my God, Social Security. Oh my God, Medicare. Oh, all these entitlement programs. We have to pay them. This would actually wind up being part of the toolkit that would start saving that money down the road and start reeling in that out of control debt. Am I wrong?
No, you are not wrong. And this wouldn't save money down the road. It would save money immediately. So right now, if we enacted site neutral payments, this would slash Medicare, the cost of Medicare, by anywhere between 15 and $20 billion every year.
Yikes.
And so that would deliver a huge amount of savings.
Seriously.
That would really help a lot of these debt ceiling negotiations right now. And on top of those savings, that would actually deliver a lot of savings directly to seniors as well. Because remember, seniors also have to pay for healthcare premiums into the Medicare program. And there's been a lot of great estimates showing that this would reduce the premiums that seniors pay by about $100 billion over 10 years.
That's it?
So,
just $100 billion? I mean, come on.
that's
What
it.
are you talking about here? We're talking about trillions of dollars. But no,
I
I'm
know.
serious. I'm kidding because I care.
Yeah. Well, I'll tell you this. You're making a very good point. Healthcare has been broken by many, many decisions by many, many folks over many years. And site neutral payments is one very important solution, but it's not the only one. Certificate of need reform is going to be a major reform. Expanding health savings accounts, making sure we have direct primary care access. Those are all going to be pieces of a larger puzzle to give power back to patients through the personal option.
And I know that we try to be nonpartisan here, Charlie, and I really truly believe. I mean, there are folks in Virginia like Senator Chap Peterson, who I just love, especially in his eloquence, and especially when it comes to individual rights and freedoms, constitutional rights and freedoms. So I believe wholeheartedly that a lot of our friends who are members of what I refer to as the tenacious D's, that for whatever reason, will hear this and say, well, yeah, that kind of makes sense. In the House, though, how powerful is the grip of the party to keep people who might hear what you're saying and say, oh, that kind of makes sense, and keep them from actually voting for it, to support it, to get it into the president's hand?
Well, I'll tell you this. On site neutral payments and a lot of these hospital competition issues, it isn't Republican versus Democrat. It's folks that listen to their constituents or folks that listen to large organized hospitals. And that's really the fact. There's actually been a lot of great Democrats who are sick and tired of the way Medicare has been paying and the way that they've been subsidizing these monopolies. Representative Custer has actually partnered with Representative Hearn in the House of Representatives to really sponsor a site neutral bill of their own. This is a bipartisan bill. And I think a point that I try to make as often as possible is that this is a Medicare reform that saves money, and it doesn't remove a single person from the program, and it doesn't cut a single benefit. It simply allows the system to operate at much lower cost.
Well,
that's all it does.
Where's the fun in that? How can I run out to the TV cameras out in front of the steps on the Capitol and say, "Oh my God, they're going to throw Grandma from the train"? And I guess that's the thing. Now, what about the opposition? What should the listener be aware of if they mention this? Because I can hear, whether it be Inova or Centara or even UVA Health, say, "Oh no, it's much safer for us to have everything in our control," Charlie.
Yeah, I would just say that hospitals are valuable pieces of our healthcare system, and they're valuable players and deliverers. However, we need to make sure that they just simply don't run the show. Americans for Prosperity is pro competition, and we want more hospitals, frankly, in our system. More hospitals that are owned by different owners and different companies competing for patients' dollars. And that puts patients in charge of what is delivered and making sure that the healthcare that's being delivered actually meets our needs. So that's what I would say.
Now, can you extrapolate this? I know we were joking earlier about applying this to retail and manufacturing and all these other things, but what about other parts of the mandates system, the Social Security and those sorts of things? Can this be expanded or tweaked so that it can apply to the Veterans Affairs Administration and other places, especially where health care is provided, Charlie?
Well, I don't know. I don't think site neutral payments is actually an issue or a problem that is facing the veterans healthcare system that veterans rely on. But I will say this: the veterans have been able to now access care in private community-based settings as a result of the Mission Act.
Mm-hmm.
However, because they are now entering the civilian healthcare system, they are still under the same constraints and burdens and barriers as everyone else is. They have to deal with certificate of need laws. They have to deal with scope of practice
Right.
restrictions on nurse practitioners. So the onus falls on state lawmakers again to really look at what are the laws that we are imposing on our healthcare system, and are they actually making us healthier? Or are they making care less scarce and more expensive?
Yeah, I
And
think.
that's something that lawmakers should always be looking at.
Well, and I think that what we really need is a bunch of these representatives to be embodied by Reagan's words. It's amazing what you can accomplish if you don't care who gets the credit. Because
Hmm.
I think right now Washington is crippled with a lot of folks who want to get some podium time and say they've done something for someone, and rather than letting them do for themselves. Last issue for you, Charlie Katebi from Americans for Prosperity and their plan to save Medicare and perhaps all of us in the process. No pressure, though. Is the issue that I always hear come up with Medicare is that their reimbursement rate is bad. They can't get enough doctors because doctors don't want to do it, and they don't pay, and it takes forever. You have to everything is a fist fight to get reimbursed for it. Does your plan take that into account, or was that a straw man argument?
So doctors, I will say this: doctors complain all the time, with good reason, about how Medicare reimburses, how private insurers reimburse. It takes a very long time for them to
Mm-hmm.
get reimbursed through our health insurance and Medicare system. That absolutely needs reform. But I think any discussion about raising rates, raising service reimbursement rates within Medicare, that needs to be that needs to be considered in light of the fact that Medicare is going insolvent in just a few years. In 2031, a major piggy bank in Medicare is going to run out of money, and there will be a lot of very serious benefit
Mm-hmm.
cuts. And that's why site neutral payments is so important right now. Does Medicare need to be reformed and streamlined so that both doctors and patients can get their needs met? Absolutely. But any discussion about raising rates needs to be considered in light of the fact that money is simply running out of that program,
Mm-hmm.
and there needs to be some real savings initiatives that are considered to make sure that that program is actually available for our seniors.
You bring up the baby boomers who at one point were the reason the pyramids of Medicare and Social Security worked so well, because there were so many of them and there was so many of them in the workforce that they were paying in. I think it was 20 some odd people paying into the system for every one person that was receiving benefits. Now I think the number is down near 3 employees to every recipient of benefits. And I don't want to sound like a ghoul, but time is marching, and every year there are fewer and fewer baby boomers at the high end of the baby boom. Is this a demographic issue that in 10 or so years we're going to start seeing an easing of it? And if we can get programs like this in and help us get an extra 10 years out of Medicare, we'll see a demographic shift that's going to reduce the number of people receiving Medicare, even if we don't increase the number of people paying in, Charlie?
Yeah, well, if you're asking how do we shift the demographics of this country so more people are paying into the system while we can take care of our retirees, I mean, I don't know the answer to that. I
Hmm.
will say there are a number of solutions we can implement and we should be implementing immediately to make sure that Medicare is more sustainable. Introducing more health savings accounts
Yeah.
so seniors have more control over their healthcare dollars. That's a major reform. Introducing direct primary care alternatives. But the clock, like you said, the clock is ticking. We have 7 years before that major trust fund in Medicare runs out. And it's very frustrating that lawmakers are fist fighting about a lot of issues, but they're not thinking about how do we tackle this major driver of our debt and
Hmm.
spending, which is Medicare.
Oh, is Medicare hit by the same thing the Social Security Trust is, which is a lot of what is in there is sovereign debt? As I said, somebody said, "Oh, well, the problem at Silicon Valley Bank was the sovereign debt." I said, "You mean like the sovereign debt the Social Security Administration holds? Is Medicare facing the same issue where a lot of what they have in there are metaphorically IOUs?"
Well, they own, well, that trust fund, yeah, is made up of US Treasuries. So the way that they pay that down, so that trust fund is falling.
Hmm.
And so to pay out benefits, they're selling those treasuries back to investors in the form of cash to make those reimbursements, to make those payments to hospitals. So is there going to be a point where, if you're asking, is there going to be a point where investors stop buying those treasuries? I don't know. I don't know, but I don't want to find out. And that's why I think it's very incumbent for lawmakers to really think about
Hmm.
how we can refurbish the program, introduce some real
Yeah.
reforms into that program to make sure that we don't have to think about that nightmare scenario
Well, and
that's
and
coming.
and if you take the investors, the Wall Street paradigm, show that hey, we've just reformed the system to make it this much more efficient, and
Mhm.
then people might be more willing to invest in it.
That's possible, potentially. That's true.
Yeah, it's a
That's
side
true.
benefit of your plan, Charlie. Where can people read the plan again?
Yes, they can go to americansforprosperity.org or they can Google AFP site neutral payments. They can take a look at the letter. They can take a look at the reforms we're talking about. And if they think that this is the solution, which we do,
Hmm.
to really bring down the cost of care and really address this hospital monopoly problem, I would urge them to reach out to their elected representatives and let them know that this is a solution that they're looking for.
Well, Charlie, I very much appreciate your time here on the Afternoon Constitutional, as well as Freedom and Prosperity Radio, and our friends at the Virginia Institute for Public Policy. I appreciate it, and you have a wonderful afternoon, sir.
I appreciate you as well. Have a great afternoon.
And we're going to pivot a little bit here, but I want to nominate Charlie as a hometown hero for us. And Hometown Heroes are a program that was started by a local law firm, Allen, and they continue it, and the nominations are continuing as time goes on, and they can you'll be seeing allenandallen.com, and we're going to talk a little bit about this because these are the things, and it's the simple stuff. I mentioned Reagan in the earlier bit. Where we were talking about, it's amazing what you can accomplish if you don't care who gets the credit. That is so true, and I don't know what you do on the other end of this video, but whatever you do, think about all the times where amazing things have happened, and then think about the fact that a lot of it has come about because you've been able to do something without worrying about who got the credit for it. Joining us now, and as I mentioned, Allen and Allen. Hometown Heroes going on and getting closer to, I guess, the deadline for nominations. Joining us, David, thank you for taking some time back out with us this week. How have the nominations been going?
Of course, Joe. Thanks so much for having me. They're going well. They're rolling in. The deadline is the end of the month, which, as you say, we're fast approaching. So we're kind of making our final push here to get the word out and ask for the hometown hero nominations. That'll be due by the end of the month.
Are there criterias for folks who are thinking about nominating somebody for a hometown hero? I know we talked about it a little bit a couple of weeks ago, but again, reminder. I mean, it's not somebody who he saved 6 puppies from a burning tree. Certainly that is laudable, but sometimes it's even in the minutia where people can find those hometown heroes.
Right, exactly. And it's a good question, and it's a question we get every year. And what I always say is Allen & Allen is not putting any parameters in terms of criteria on it. We are asking people out there in the community, you tell us who is a hometown hero, what makes a hometown hero. And I think because of that, over the years, 14 years now, we've really gotten a great variety of types of people. So, that's individuals with formal affiliations with nonprofits or through their career, things of that nature. But as you say, it's also, we're looking for individuals out there who are doing things quietly, unseen, unspoken, that are perhaps not getting the recognition that they might deserve. And we're kind of looking for opportunities to recognize those folks.
David Irvine is on with us, one of the attorneys with Allen and Allen. And, one of the happy chores they have is when they get to do this, when they get to talk to these folks. Highlight for you, David, some of the folks who have been Hometown Hero awardees, recipients over the past decade that you've been doing it.
Yeah, I mean, there've been so many. So we've actually, at this point, recognized over 500 hometown heroes. As I said just a moment ago, this is our 14th year. So we've had quite a few. I'm here, of course, in our Charlottesville office. We also have offices in Richmond and Fredericksburg. So we're drawing from those areas. I've gotten to know the local Charlottesville folks best of all. And there've been a number. So a couple of years ago, I remember working and getting to speak with Annie Dodd, who manages All Blessings Flow, which provides used medical equipment to people that need that. And she's been a great person that we've developed a relationship over the past couple of years. Stretching way back, this is probably close to 10 years ago now. There was a young man that we recognized who had some sort of health challenges of his own, but he had taken the initiative and organized a coat drive for people who were less fortunate. I got to know and really enjoyed getting to know Rhonda Oliver last year. She was a hometown hero just for us last year, and she runs essentially a food bank up in Stanardsville and has been very successful with that. So those are kind of off the top of my head, but it's really just the tip of the iceberg.
And I know you have 3 locations, Fredericksburg, Richmond, and Charlottesville, that are participating in this, David. And is there ever any competition in between the offices to say, we got more than you did? And I'm sure I'm teasing, but I'm sure at some point it's a little bit of a matter of pride to say, we had more in Charlottesville this year than ever before, and that kind of thing.
Well, I can tell you we have a committee at the firm each year that selects the heroes. And of course, we're selecting it based on merit, of course, and those individuals we want to recognize. But I think we keep it reasonably well balanced. But, it's a little bit of a sensitive subject because Charlottesville is a little bit smaller of a town than Richmond. So we have a little bit smaller of a community to draw from. But that's why I'm here with you today, Joe, to try to drum up the Charlottesville nominations.
Well, and let me ask you, have you noticed since COVID, and I know COVID-19 really and the pandemic shutdown orders, it really changed the world and kind of put everything in different perspectives and brought a whole bunch of new people doing different things to the fore of the Allen & Allen Hometown Heroes program. Now that we're post-COVID, PC, we've had VC Day, Victory Over COVID Day, when the president said COVID's over, or the emergency is over. What have you seen in terms of the nominations that you've looked at, that you've seen so far? I don't want you to give out any names or anything like that. Have you noticed a shift, though, in what people are doing or the veracity for which they're doing it?
Well, it's a very interesting question. In 2020, we had the Hometown Heroes program, just as we always have over the past number of years. But I don't want to say it shifted the focus, but we asked specifically for individuals who were going above and beyond to address the various issues that people were dealing with during COVID, medical situations, but also situations where people were out of work and things of that nature. So we definitely got a terrific group of people that year for sort of COVID related work that they were doing in the community. That was really fantastic. Since then, I don't know that there have necessarily been any trends. I mean, we've gotten fantastic people for years prior, and we're still having them. But it's an interesting question to reflect on.
So what is the deadlines? What are we looking at when it terms of when people have to have their forms in by, and what do they need to have if they're thinking about it? They're watching right now and they say, "Oh, I do know somebody who could do that," and what do they need to kind of put together to send to you guys at allenandallen.com?
Yes, exactly. So that's exactly right. You go to allenandallen.com to download the form. They're also available on the social media pages, Facebook and Instagram and things of that nature. You can also stop in our office to get a form as well. We moved a couple of years ago, and our new office is in the Dairy Central here on Preston. So always welcome to stop in to pick up a form there. But it's a relatively straightforward form. It doesn't take too much time to fill out, but you just go through the questions to nominate the individual who is deserving of hometown hero recognition, and then just submit the form. It goes to our committee here, and May 31st is the deadline. The nomination period essentially has been the month of May, so we want to have those in by next week.
Well, and it's not like, we just went through a bunch of political party nomination processes, some of them still going on. There's no polling places. You don't need voter ID, and you don't need to sit in a hot gymnasium for hours on a Saturday either, right, David?
Nothing like that. We want to make it as easy as possible for people because we want those nominations rolling in.
Well, I appreciate your time. Now, are you part of the committee that judges these, or do you have, other clients to deal with? What's your role in the Hometown Heroes program, or do all the attorneys at Allen and Allen, even the ones not named Allen, take a
That's
role?
right. That's right. I'm not an official Allen yet, but we're all Allens. I'm not on the committee this year. It's not the committee changes each year, so I have been in the past. I do not happen to be this year, so I don't know that I can necessarily, call in any favors. But we've got a good group of people that review each and every application.
Well, I'm sure the title committee member emeritus could be applied and put on somebody's desk plaque. But David Irvine with Allen and Allen, good to catch up with you again, and enjoy the rest of the beautiful day. And again, the 31st is the deadline for Hometown Heroes.
That's it. You got it. Thank you so much for having me, Joe.
And thank you all for tuning in as well to our program today. And I hope it's been illuminative for you. And we will be back here in this space tomorrow. J.P. Sears, comedian, fellow who knows a little bit more about this milieu than I do, and a person who my wife has been watching for a very, very, very long time and has watched a political evolution in his world that is not unlike many people face. He started out pretty much just kind of making fun of the self-help guru space, and then little by little found himself running afoul of people who run organizations like YouTube, and started to say, well, hold on a second here. I thought we were about free speech. So we're going to visit with J.P. Sears tomorrow on this program. Until then, for all of us here, so long. There's the camera. So long. Hey, I do this in the radio show, and I don't care who sees it, but so long. And thanks for all the fish.